Deoxygenated, so where's that blood going to go?
From here,
Okay, and so what is that vessel?
the inferior vena cava,
All right, and so that's going
Vena
to,
cava.
it's going to wind up where first?
the atrium, the right atrium.
Right atrium. And so is there any other blood entering this besides the inferior vena cava? What other source of blood is there for the right atrium? So we have inferior vena cava,
Inferior vena cava.
and then what about this opening right here?
This superior vena cava.
Superior vena cava. So we have those sources of deoxygenated blood in the right atrium, and it's going to head where next?
Into here,
Okay, and so what valve is that?
the bicuspid valve.
Point to that again, please. Where's the bicuspid valve?
Well, it's not the bicuspid valve.
Oh,
The only one that has two cusps in the whole body is which valve? There's 4 valves. They have 3 cusps except for one,
semi-lateral.
and it's called bicuspid, and it's located where? It's located here. Okay?
So where
Oh, the
the
tricuspid valve.
Exactly.
So wait, the
That's-
bicuspid valve is in the left ventricle?
Yes.
Okay, got it.
Between the it's the left atrioventricular valve.
Okay, great.
So we have the tricuspid, and the blood's going to drain into the
The right ventricle?
right ventricle. And this valve has these white strings that are called, they look like cords.
Chordae.
Yep, chordae. They also look like tendons. Chordae tendineae.
Chordae tendon.
Which is attached to these little tiny muscles called the papillary muscles. All right. All right. So now the blood's in the right ventricle. Where's it going to go next?
Up here,
Up here. And what is this structure called?
the pulmonary valve.
Pulmonary valve.
Pulmonary valve.
And then this is going to be the,
Pulmonary trunk.
okay. And is that an artery or a vein?
That's artery.
Right, because it's leaving the heart. All right. And it's going to go directly to
The lungs.
the lungs. Can you show me the 2 branches? So it breaks into 2 branches.
The left lung, and this goes to the right lung.
Right lung. Okay.
So wait, left lung
Yep.
and right lung.
Okay.
Gotcha.
So now it goes to the lung, gets oxygenated. So now it's going to go back to the heart, right? So what structure are we going to use? Because we had pulmonary artery going to the lungs. Now we need.
The veins,
Okay. So we're going to call them what? What are we going to call those veins?
the pulmonary veins.
Perfect. How many of them are there?
4.
Okay. Can you show me some of them? 2 and 2. And they're draining into the.
Pulmonary veins draining
The
into the
Where are they
well
dra-
here,
which is the
the
left atrium.
yeah.
left atrium. Okay. And where's the
So
blood?
wait, both of the veins are draining
All
in?
4?
All 4, okay.
Yeah.
All 4 veins are draining into the left atrium. Got
Right,
it.
and we can see those little openings right there. All 4.
got it. There's 4. Okay, cool.
So now it's going to go through this structure.
Bicuspid valve.
You said bicuspid?
Bicuspid.
Okay. Into the
Left ventricle.
left ventricle. And where's it going to go from the left ventricle?
To the body.
Well, it's got to pass through something. I
Okay.
was going to get there.
Where does it pass? Let's see. Is that valve right there?
Oh, yeah.
Okay, and what is that called?
Okay, let me grab.
The
Because you were here on Monday, I'm pretty sure, right?
Aortic valve.
Aortic valve. It's called the aortic valve. The aortic valve
Don't
is
spread it
right
over. I
by
don't want
the
to skip class.
bicuspid valve.
It's going to be
Okay.
an important time.
Okay, so now it's going up into the.
Aorta.
All right. And then we have, where's it going to go from? What part of the body does this go to? Upper or lower body?
The upper.
Okay, and this goes to the
Lower
lower.
body.
So these are going to lead to
Head and
what are the upper body structures?
The arms.
arms and
head.
head.
In the head. So we have this side goes to, is this left or right?
The right arm.
This is the right arm and head.
Dr. Murphy, what are the names of these then?
So this one's going to the right arm and head.
So-
So what is our fancy words for arm and head?
Brachial.
Brachial, we got that one. And head? Brachiocephalic.
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 And then on this side we have the
the carotid arteries.
carotid artery, and
And
the,
this is the lower body,
so
so,
no, lower body's down here.
okay, so this is the,
Vessel that brings
Oh.
blood back to the heart.
the left,
Left subclavian.
oh, left
Subclavian.
subclavian, okay, left subclavian, got it, okay. And then this, what is this piece? This is the
Descending aorta.
descending, where's the ascending aorta?
Right here.
Ascending aorta, descending
Arch.
aorta. What's the arch called?
Arch.
Just the arch,
aortic arch.
okay. And there are 4 valves in the heart. Can you review where the valves are for me?
Okay. Go ahead.
But not
The
really.
tricuspid valve,
Okay,
bicuspid valve,
gotcha.
aortic valve,
Okay,
the pulmonary valve.
okay.
Okay.
Is this one called the semilunar valve also? I think she
I
called
think
it.
she's been
Yeah.
calling them semi.
Okay, but you call this the aortic valve?
Well, not a, I
Oh,
would,
pulmonary, no, I'm sorry, I don't want to get, okay, pulmonary
and
valve.
so whatever term she's wants you to use, please use that.
Okay,
It just helps me to know where it's going to and who it's attached to.
I think she wants us to use
Semilunar? Okay, go for that.
just put semilunar in the word thing.
so
She'll be
the
happy.
pulmonary valve is the same as the semilunar valve? Okay, cool, great.
So the base of the heart is,
Yes, I would say you probably want to try
It's
some.
like
So this is the apex, right?
that's the apex.
And this is the base?
And the base is where the blood vessels are, so that's the
Okay.
base. Okay, and these were called,
auricles.
okay,
What are they called?
auricles.
Or oracles.
How many auricles are there?
Looks like there's 2.
2, one for each atrium. Okay. And
What does
this-
the oracle do?
It's part of the atria, so I assume it's going to contract a.
Okay, oh, so it's just a muscle structure. I got it. Cool.
So, how many chambers we got?
4 chambers.
Which is the most muscular?
Left ventricle.
All right. And the second most?
Right ventricle.
Okay. What else did we need to cover? And you did. This is the
Trachea.
trachea, and this is the
Esophagus.
esophagus. So this is the
Oh, the bronchioles or the.
bronchi. Yeah,
Bronchi.
it's a branch of the trachea. It's because you can see the cartilages.
Right,
Which are-
right.
What shape are they?
Like rings, aren't they? Like C-shaped?
C-shaped.
Yeah.
Okay.
Wow. You should do a video on YouTube, Doc. You know.
What did we leave out? Okay.
Oh, there was also the papilla one. The papilla was, I don't know if this model shows a papilla, and then the, what does she call it?
Papillary muscle.
The
We
papillary
did see that, and then we saw the
trabeculae carnate. Where, Zach, where's the trabeculae carnate?
It's
chordae tendineae.
this stuff.
Oh, so this one. Oh,
This
yeah.
is the trabeculate.
Yeah, here we go. Trabeculae carnate and pectinate muscle,
She
right?
said to think of this as like the trabecula of like the spongy.
Right, the spongy bone and the long bones. Yeah. Okay. Cool.
It looks like it almost.
Excellent.
Yeah, and did you find sulci that you were going to show us?
The which was that
The sulci you were.
Oh yeah. So she pretty much said that they're depressions, I guess.
Yeah.
And I just know that they're depressions. I don't want to like say any false information, but so this is one right here.
Okay.
And then there's specific names for them, but she said just know them as sulcuses.
Sulcus.
So
Okay.
like there's one right
Got
here.
it. Okay. And a sulcus is just a depression.
Depression.
Okay.
And then
Got
this
it.
is there's also right here. This is the coronary artery.
Coronary artery.
Taking blood to the.
Coronary
To the heart.
artery.
It's like its own cardiovascular system.
Wow. All right. Thank you. Thank you so much.